Okay, let's unpack this. There's this statistic floating around. Over 400,000 people in South Korea estimated to be drug users this year, 2024.
Yeah, that's from the Ministry of Health and Welfare. And it really it makes you pause, doesn't it?
It really does. It suggests a kind of hidden reality, maybe something you don't immediately see.
Exactly. And what's interesting is how we're approaching this. We've pulled together quite a few different sources, news articles, some legal perspectives, especially for expats.
Academic research, too, and
Yeah.
even some online forum discussions, right?
Right. So we get these different angles on the whole drugs situation in South Korea. It's
Yeah.
not just one viewpoint.
Yeah, that's the idea. So for you listening, we're aiming for a real deep dive today. We want to go beyond the headlines, pull out the key bits, maybe some surprising facts, just to give you a clearer, more nuanced understanding.
Think of it as us wading through the data so you don't have to, but getting you those crucial insights.
Exactly. Our mission, if you will, is to unpack this data, look at the laws, the social attitudes, the whole picture around drug use in Korea.
Precisely. Taking that big number and seeing what's behind it, how the law works, and how society itself deals with it.
Okay, so let's start with that number, the scale of it. Over 400,000 users estimated in 2024. How? How do they even arrive at a figure like that?
Well, the method they used, according to the report, is they take the number of people actually investigated for drug use that was around 13,351 in the period they looked at,
Okay.
and they multiply that number by 30. It's a multiplier they use to try and estimate all the users who aren't caught, the hidden population, basically.
Right, so it's an estimation technique to capture the unseen part of the iceberg. And this number hasn't stayed the same, has it? We have older figures.
We do. Back in 2019, the estimate was around 246,300. Then by 2023, it was up to about 326,970.
So definitely an upward trend over the last few years.
Clearly, the estimates are rising.
But hang on, one of the news articles brought up a good point. Could this increase be partly because law enforcement is cracking down harder?
That's a really important question. More investigations could mean more detected cases, which then inflates the estimate using that multiplier method.
So it might be a mix, potentially more actual use, but also maybe better detection.
It's very likely a combination, yes. We also have a harder number from the Supreme Prosecutor's Office. 27,611 people investigated for drug crimes in 2023.
And that's not just use, right? That includes
Yeah.
distribution, possession.
Exactly. It's a broader category of drug-related offenses, so it gives us another data point focusing on direct legal system interaction.
Okay, so we have the big estimate, maybe 400,000 users, and then the smaller concrete number, around 27,000 people actually investigated. Now let's talk about the laws. South Korea is known for being incredibly strict.
Absolutely. Zero tolerance is the phrase you hear, and they mean it. It covers everything, even marijuana, which, as you know, is treated very differently in lots of other places now.
Yeah, that's a key difference. So this strict stance is really baked into the system.
Deeply. It's fundamental to their legal and social approach.
And the consequences, if you get caught, they can be really serious, especially, it seems, for non-Koreans.
They really can. For anyone, Korean or foreigner, you're looking at potentially huge fines, millions of won in prison time. Months, maybe years, depending on the specifics.
And for foreigners.
For foreigners, a drug conviction almost always means deportation, plus a ban on coming back to Korea. It's very severe.
We looked at a legal source that works with expats.
Yeah.
What are the common ways foreigners get into trouble with these laws?
Well, the most obvious is possession or actual use of illegal drugs. Even small amounts can trigger serious charges.
Right.
Then there's trafficking or distribution that carries the absolute heaviest penalties, often long prison sentences.
Makes sense.
But interestingly, they also mention unintentional violations, like someone brings in prescription medication that's legal back home.
But it's controlled or illegal in Korea.
Exactly. Or maybe it is allowed, but you need specific Korean documentation for it and the person doesn't have it. That can lead to charges too.
Wow, that's a crucial warning for anyone moving there or even visiting. You really need to check the rules for all your medications.
Definitely. You can't just assume.
So if someone is suspected, say, they get stopped, what happens then? What's the process?
Typically, it starts with an investigation. Police, maybe customs, could involve a drug test, searching belongings, or your home.
Okay.
If they detain you, they can hold you for questioning for up to 48 hours before needing a formal arrest warrant.
2 days. That sounds like a critical window.
It really is. Having a lawyer involved immediately is vital to protect your rights during that time.
I can imagine. So after those 48 hours, if they get the warrant,
Then it moves toward court. Evidence gets presented, drugs found, test results, statements, and sentencing considers everything. Type of drug, amount, was it just used or selling, and your past record.
It also sounds like authorities are focusing enforcement efforts, like in certain places.
Yes, the news reports mentioned a coordinated effort. Prosecutors, police, even the Seoul city government targeting clubs and entertainment districts specifically.
Trying to clamp down on the nightlife scene?
Seems so. And separately, the Supreme Court is looking into the misuse of prescription meds, particularly strong opioids like pethidine and fentanyl.
Okay, so it's a broad approach. Strict laws, targeted enforcement, and now attention on prescription abuse too. Let's shift gears a bit. Why are the laws so strict? Is it just policy, or is there something deeper, culturally or historically?
This is where some of those online discussions, like on Reddit, get really interesting. They suggest it's deeply tied to Korean culture. There's just very little social acceptance of drug use.
Low tolerance generally.
Very low. And there was this striking example mentioned how the media might report a celebrity caught with marijuana almost like they were caught with crack cocaine.
Really? So maybe not much distinction made between different types of drugs in the public eye.
That's the implication, a sort of blanket condemnation. And then there's this historical angle from Reddit. Apparently, back in 1976, President Park Chung-hee explicitly linked marijuana use to communism.
Wait, what? Marijuana equals communism.
Yeah. It was during a tense political time, Korean War technically still on. He apparently said it would bring ruin to our country. It was framed as a national security threat, linked to the ideology they were opposing.
Wow. That's a powerful historical association. You can see how that might cement a really strong cultural taboo.
Absolutely. The idea is that this historical framing, linking drugs to an existential threat, really solidified the strict laws and the deep cultural aversion. And maybe that's why it hasn't changed much, even decades after democratization.
That's fascinating. And the Reddit thread also mentioned geography.
Right. South Korea is basically like an island bordered by the sea and North Korea. This makes smuggling drugs in physically difficult.
Less supply coming in.
Potentially, yes.
Yeah.
Which might mean less common usage overall, and therefore less public pressure to relax the laws. It also means, apparently, that the drugs you can find, often in foreigner areas in Seoul or Busan, are very expensive and maybe not great quality.
So tough to get, expensive, and risky. And the discussion suggested most Koreans just wouldn't even think of trying something like marijuana.
That was the impression. Too scared of it, never encountered it. And the consequences are just too high jail for Koreans, deportation for foreigners.
And this fits into a broader cultural pattern mentioned about following rules.
Yeah, some users connected it to a general cultural tendency in Korea to adhere strictly to rules and authority, giving examples from work culture, like taking vacation days. So that general respect for rules might reinforce the strictness of the drug laws, too.
Okay, so it's a complex mix. History, politics, geography, cultural version, rule adherence, all feeding into these strict laws. Now, what about the people who do develop addictions? What's the social reality for them? Our academic source looked at stigma, right?
Yes, a national survey. And the findings are pretty stark, huge social stigma. For example, 88.3%, almost 9 out of 10 people disagreed with a family member marrying someone with a drug addiction.
Wow, 88%. That's incredibly high. What about in the workplace?
Similar story. 72% disagreed with having a drug addict as a colleague. So real barriers in personal life and work.
And it's not just disapproval, it's actual discrimination they looked at, too.
Yes. They asked about discriminatory actions. 72.2% agreed landlords should have the right to refuse renting to someone with a drug addiction history.
And employers.
Even higher. 78% agreed employers have the right not to hire them.
So while the disapproval is high, the willingness to actually discriminate in housing and jobs seems even more widely accepted. How does this compare internationally, say, to the U.S.?
It's interesting. The comparison suggested that maybe some underlying attitudes of stigma might be slightly lower in Korea than the U.S. study they compared it to, but the agreement with discriminatory behavior like denying housing or jobs was actually higher in Korea.
That's a really crucial difference. Less overt stigma, maybe, but more acceptance of practical discrimination.
That's what this research suggests, yes. A willingness to endorse those exclusionary actions seems more prevalent.
Did the study find any patterns, like who holds these views more strongly?
It did. Demographics mattered. Women, older adults, 40 and over, and people with higher incomes tended to show more agreement with the stigmatizing statements.
Higher income correlating with stigma. Interesting. And also with discrimination.
Yes, higher income also correlated with more agreement on discriminatory behaviors.
What about personal experience? Did knowing someone or, personal habits make a difference?
It seemed to. People who reported having misused opioids themselves or who drank alcohol or smoked cigarettes showed significantly less stigma. It fits the familiarity hypothesis. Maybe being closer to substance use reduces judgment.
Makes sense. And non-smokers.
Non-smokers, conversely, were more likely to hold both stigmatizing and discriminatory views.
There were also some findings about views on treatment, right? Kind of counterintuitive.
Yeah, a bit complex. People who believed addiction requires medical treatment were actually more likely to stigmatize. But also people who were against more government funding for treatment were also more likely to stigmatize.
Hmm. So maybe a belief in treatment, but still holding negative views. Or maybe skepticism about government help correlating with stigma. It sounds complicated.
It does suggest some potentially contradictory beliefs swirling around.
And the impact of all this stigma and discrimination must be huge for people trying to get help.
Absolutely devastating. It's a massive barrier. Makes people afraid to seek treatment, hard to stay in it if they do, leads to isolation. It can really worsen outcomes.
And it even affects healthcare.
Yeah, the study mentioned that even healthcare professionals can hold negative attitudes, which obviously impacts the quality of care someone receives.
So we have strict laws, strong social disapproval,
Hmm.
but people still develop addictions. What about help? Is treatment available?
There are resources. One report mentioned 31 major hospitals designated across the country for drug addiction treatment.
Okay, 31 hospitals. Are people using them?
The numbers treated have gone up, which is encouraging, from 260 people in 2019 to 641 in 2023. So more people seem to be accessing that hospital-based care.
That's positive. But there was a catch, wasn't there? Something concerning in that report.
There was. It also revealed that 13 of the state-designated addiction clinics separate from those hospitals maybe treated absolutely zero patients in 2023.
Zero. 13 clinics treated no one.
That's what the report said. It raises big questions. Are they hard to access, poorly advertised? Is the stigma so bad people avoid them? We don't know the exact reason, but it's concerning.
Yeah, definitely. Especially when another source mentioned a proposal specifically to activate rehabilitation centers. Suggests there's an awareness that something isn't working quite right.
Exactly. It points to an ongoing need to improve how these services are delivered and accessed.
So resources exist, treatment numbers are rising in some places, but there are clear gaps or problems with accessibility or utilization in others.
It creates this real tension, doesn't it? You have this strong push for enforcement and prevention, but then these difficulties in effectively helping those who are already struggling, maybe partly because of the surrounding social climate.
Okay, let's try and pull this all together. What are the key takeaways from this deep dive?
Well, first, that estimated number of drug users is surprisingly high, over 400,000, and seems to be trending up.
Right. Second, the legal situation is extremely strict, zero tolerance, rooted in some unique history, like that marijuana communism link and broader cultural factors,
Third, there's significant social stigma and, perhaps even more worryingly, high agreement with discriminatory practices against people with addiction.
which creates huge barriers. And finally, while treatment facilities exist and some are seeing more patients, there are also signs of underutilization or problems, with some clinics apparently empty.
And revisiting that historical connection, Park Chung-hee linking marijuana to communism, it's just such a striking example of how specific moments can shape long-lasting, deeply negative perceptions about drugs.
So for you, our listener, what does this all mean? It really paints a picture of how complex dealing with drug issues can be. Laws, culture, history, public health, they all intertwine.
Yeah, it shows how a country can have this incredibly strong anti-drug stance, legally and socially, but still grapple with the reality of addiction. It makes you think about how different societies handle these same challenges, the different levels of stigma, the different approaches to help.
Absolutely. Which leads us to a final thought, maybe something to chew on. Given these really strict laws and the powerful negative views in society,
Yeah.
how can South Korea best help people who are struggling with addiction?
Is the current focus heavily leaning on punishment and enforcement enough? Or should there be more exploration of other strategies, things like harm reduction, making treatment truly accessible and free of stigma, tackling those deep-seated social attitudes?
Right. That gap between the strong social disapproval and those rising estimates of use. It does make you wonder about the effectiveness of the current approach, doesn't it? And what hidden struggles might exist beneath the surface.